Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, heads up Birmingham. The name of Vulcan Imaging Associates, a group of radiological doctors, has appeared in the news again. This time they have sponsored the Breast Cancer Research Foundation of Alabama's third annual Disc Golf Goes Pink tournament. This was held September 9th, 2023 in Calera, Alabama. Says they were raising critical funds for local breast cancer research and netted $7,500 thanks to community support and sponsors. I hate to ruin all the warm and fuzzy feelings out there. I was a patient under the care of Vulcan Imaging Associates Neuroradiology specialist Dr. Brant Ruff MD. He looked at an MRI scan I had done in 2019. I'll put the images and what his analysis of the scan was in this video. I had broken the underside of my skull, an injury I almost died from. 6 inches of infection appeared in the MRI. This doctor, who graduated with honors from the University of Tennessee, he noted no injury present in this scan. I got a copy of my records. I later found the truth of this injury. I took this issue back to Ascension, St. Vincent's Hospital, Birmingham, Alabama. They would do nothing to correct this error. I tried to contact Dr. Brant Ruff directly through Vulcan Imaging Associates. They would not do anything to correct this error. These phone calls were recorded. You can hear them on my YouTube channel, and I'll play my call with Vulcan Imaging Associates following this introduction. Administrative Coordinator Kim Mooney, who I'm speaking to in this call, she possesses no medical qualifications whatsoever. Well, she didn't go to college for 10 years to match the credentials of Dr. Ruff, who missed this massive injury. So she can't talk about this, and she also failed to name a medical professional who was so qualified. They got 40 plus such individuals on their payroll. Looks like Vulcan Imaging is trying to make inroads into the town of Calera, south of Birmingham. They're putting time and money into sponsoring events. The public out there absolutely needs to be aware of this company. My experience with Vulcan Imaging Associates and their doctors, the public out there seeking healthcare, they will not correct or acknowledge errors or mistakes, and they will not return phone calls.
You have reached Vulcan Imaging. Vulcan Imaging, this is Kim.
Yes, ma'am. I called last week. I was trying to get in touch with one of your radiologists, Dr. Brant Ruff. I had an MRI scan that was looked at by this doctor in 2019. I got a report with his signature on it saying I don't have injuries. However, in the MRI images themselves, I have evidence of a very serious head trauma-based injury. And yeah, I was told last week that you guys would try to have this doctor get in touch with me, so it's been about a week, and I just wanted to see what the status of that was.
Okay, so I did look into this, and based on, there's not anything else we can do, so there's not anything that Dr. Ruff can do to assist you with that, since the report's already been read. So there's not anything we can do.
Well, I beg to differ. This was a $700 MRI scan. This doctor was paid to have this scan looked at, and he did not note the injuries. So he is at fault. And so is Vulcan Imaging.
We stand by that report 100%.
Okay, well, the report is in error 100%, ma'am. Can I speak to somebody in management?
Yes, sir. I am the practice administrator.
Okay, can I speak to the head of the company?
Let's see.
Who's above you?
The chairman of the board.
Okay, well, I need to speak to somebody in authority because you're in error with your statement, ma'am. Not professional.
I am so sorry you feel that way, but we stand.
Well, it's not how I feel. It's the facts, ma'am.
Well, now, if you're what you're stating, we would respond. Maybe if you consulted an attorney to have.
Well, I mean, if I can't speak to somebody on the telephone about this, I'd be happy to come clear it up in person.
You're more than welcome to come up here and talk to whoever you need to talk to.
This is a serious issue.
I understand that from your perspective.
Yeah, your excuses aren't going to cut it either, ma'am.
It's not an excuse, sir. I really don't know how to help.
What you should do is, okay, you're in business, all right? Well, you have doctors who went to school for 10 years. They're millionaires, okay? They're reading radiology reports for hospitals and other doctors, okay? What you need to do is you need to have them do their job correctly. And if they miss major injuries in patients that they almost died from, such as myself, you need to simply make an attempt to correct this error. Now, I could get in touch with Dr. Michael Brant Ruff. I could supply my records. He could look at these images again, and we could clear this up in a few minutes. Could I please talk to him?
No, sir, I can't reach out to Dr. Ruff. We don't consult with patients.
That's a very sorry excuse, ma'am.
I'm so sorry. That's our policy. Let's see. What can I do to help you? Let's see. Eric Blackman is my CEO.
Well, I mean, why are you mentioning his name? Why don't you just connect me to him?
He's not in the office.
Oh, that's pretty convenient, huh?
Well, it's the truth.
Well, I don't believe you.
I'm so sorry about that.
Yeah, me too.
Let's see. What I can do is I can give you. Let's see. His direct number is.
How many radiologists work for your company, ma'am?
I have 37.
So you have 37. Why don't you take this scan, call somebody right now and have them look at this scan and correct this issue for me?
But that is not how radiology works. We can only
Yeah, you're not professional. We've already established that.